Yeah, so I'm Dr. Richard Lester. I'm a physician in infectious disease at University of British Columbia and Vancouver General Hospital. So I do research in digital health and patient care, as well as more increasingly AI in health. And I've also founded a startup, an NGO company called WelTel. Yeah, so my this project is looking at using new AI or natural language processing tools to help evaluate text conversations that happen between healthcare providers and patients. Because we started our program, our WelTel program, that uses mobile phones and texting to communicate and check in with patients in a platform, we collect a lot of that open, natural conversations between healthcare providers, sometimes doctors, sometimes nurses, other healthcare member teams. In public health, it's actually been, the program has been used to reach out to people who are being followed at home during the pandemic with COVID, as well as other reasons in public health. And the platform allows a lot of different patients to communicate with their healthcare providers, and that provides some very valuable, potentially valuable information on what types of issues patients are having, and that can give us insights into how we can improve the care and health system, be more responsive to their needs. The conversations occur naturally when they're needed, when they're most needed between patients and healthcare providers, but they also contain an infinite range of contexts, because you're not just filling out a form that someone thought about. You can talk about whatever you want. So it means that data can be very valuable, but it used to be really time-consuming to evaluate, to manually categorize it. So we've, for instance, I had a PhD student. It took 6 months to categorize all these conversations in meaningful ways. But now, using natural language processing, we can teach computers and machine language to do some of that categorization, and now with large language models, even interpret it and the meaning and even the underlying tone and semantics of it. So sentiment analysis is possible. And another focus for us in healthcare is health equity, because AI and technology should really be benefiting everybody, and language is a key component of that. So we're also working a lot with teaching our models with even low resource languages. I do a lot of work in Africa, but also here in Canada, there's a lot of different populations that speak other languages primarily. And so we're trying to ensure that these models that can be used at the community and patient level understand many different languages. Some of the limitations of current models is that they're trained on a lot of data, but it depends on the source of that data. So when people talk in very unique areas, like they do in healthcare often, or with accents or with different languages, some of the existing models out there are not fine-tuned to be able to do that very accurately. And you can imagine how important it is to have accurate information if we're trying to evaluate the conversations between patients and their healthcare providers. So I'm really excited that we're going to have some more capacity to work on improving these models, first at the level of general insights, but ultimately these will help build models that have a real ability to develop tools that can directly interact with patients in a more meaningful way. At the end of the day, it increases trust in the models if they're more accurate. So I'm really excited about the leadership and momentum behind the DASH program, the Data Science and Health, as well as the AI and Health Network at UBC. They're really showing the commitment of our institution to be able to do leading research in not just in AI, but in patient care and its applications. So I think this program is going to benefit a lot of healthcare providers, but importantly, patients in British Columbia as we move forward into this new era.